Welcome to our Melanin Hues podcast. We are women of color who are physicians and psychologists, empowering our communities through candid conversations about their physical and emotional health. I am one of your hosts, Dr. Eunice Blackman.
Hi, and I'm Dr. Kenesha Campbell.
Hi, Dr. Leela Morrow.
Hi, Dr. Chanel Richards.
Welcome back, ladies. Today's episode is called Dear Mama, Black Maternal Health Matters. This is a very special week, and we are rolling out this episode to talk about all the events that are going on regarding Black maternal health. Our special guest today will be talking about how her nonprofit addresses disparities in pregnancy and postpartum, and she'll be discussing experiences and outcomes related to Black maternal health. We'll be reviewing about feeding, birthing, labor, and a lot of other fun topics. Ladies, what are your thoughts about this?
I think this is a very, very important topic that is not normally addressed and needs to be brought to the forefront because persons of color in particular have very harrowing experiences in terms of their maternal birth processes and significant struggles throughout pregnancy in general. And it just really, in terms of disparities, it's definitely significant. And it's a topic that we really, really need to discuss.
I totally agree, Chanel. I think Black maternal health in general really highlights all of the disparities that Chanel just mentioned. So when you look at the mortality rate or the death rate for non-Hispanic Black women, it's about, they're 3 times more likely to die than white women kind of in pregnancy and in that post-pregnancy period. The statistics are really staggering, and this includes Black women who are educated, Black women who are of higher socioeconomic backgrounds. So this is not something that's limited to women who, live in poverty or only women who have underlying medical conditions. So there's just something, in this country about being Black that really leads to poorer health outcomes. And I think our guest today is really going to dig deep and dive into what some of those issues are.
I definitely agree with what you ladies have said. There's something to be said that me as an educated Black woman, college-educated Black woman, I am more likely to die than a white woman who only has a high school education. That says a lot. I know in the past that they've tried to link it to social economic status and they've tried to link it to educational level. But if those are the facts that happens, truly there's, like you said, there's something else that is underneath that is causing that. And what most people would say would be, the systemic racism that lies underneath that, causes someone else to say, maybe her blood pressure might be okay because she just seemed to be a little bit more high tense rather than having me to stay. I'm told to come back and experience more likely to experience complications from that.
Totally agree with that. I think if you guys have heard about the Serena Williams story, Serena had, a prior blood clot from an injury with tennis. So she knew kind of how it felt to have a blood clot, how it felt to have a blood clot in your lungs or a pulmonary embolism. And when she, was in the hospital kind of delivering her baby, she kept on trying to talk to the nurses and tell them, look, something's wrong. I need to get a CT scan. This is the same kind of feeling that I had before. My leg is swollen, and they were just like, oh, your meds must be making you crazy. What are you talking about? Of course, only to find out that when she did actually get the kind of ultrasound of her leg and the CT scan, that's exactly what she had. And to think that someone like at her level, like who's well known, a celebrity, an educated person, accomplished person, she still can't get someone to listen to her when she's clearly like telling you, like, I know my body and I know what I'm feeling. And, so just think about the layperson. Like they might not feel, emboldened to go and like find the doctor and say, look, this is what's wrong with me. They're just going to go along, like Eunice said, with like, oh, okay, if you think I should go home, I'm just going to go home because you said nothing's wrong with me. And I think that has a lot to do with why some of the health outcomes are so poor.
Yeah, I mean, it's so sad and devastating, and this is such a very important topic. And I think if we really look at it from an empowerment standpoint, there are these organizations, and this has become a national outcry to be able to support Black women, to have advocates, to be, your best self, come in with your questions. I don't know, Chanel, have you come across any of this in your therapy? In terms of empowering women during labor and delivery?
Yeah, definitely. Already, labor process and pregnancy in general is very laden with significant emotional content related to hormonal changes. And so people often come out with significant experiences of anxiety, depression, not knowing, an estrangement from themselves, not knowing or feeling like themselves, and having this emotional issues on top of going through these experiences where they're not feeling heard or having significant issues while in the birthing process and throughout their entire pregnancy for that matter, or feeling dismissed and that kind of thing. Like I said, this is a very, very important topic because it also includes significant issues related to mental health and maternal issues.
Yeah, thank you for saying, some of the work that you do. And in my practice, I work with newborns and, talking about that trauma, the post-traumatic stress trauma or medical symptoms that the parents are facing. So, they went through this birth process and now their child is in the intensive care unit and they are grieving. They thought that they would have this very healthy child and something else has happened. And so, that constant stress and anxiety can certainly play a role. And I think that's why it's really, really important, not only from the preventative standpoint, but also from the treatment standpoint, to have counseling, to have doula support, to have people there to be your advocates and help guide you through the process.
Absolutely. I mean, I work with adolescents, and unfortunately, we have many adolescents who have babies unintentionally. And so, I think, in addition to talking about that pregnancy period, it's really important to kind of educate women about what to expect after they deliver the baby. How may they feel? They may not be so happy as everyone thinks that you're supposed to be after you deliver the baby. And maybe that's okay. Maybe it's not. And what are the, red flags to look for if it, for it not to be normal, postpartum blues. So I think, part of it is the educational piece and just really making sure that adolescents and women, older women, are aware of kind of the broad range of emotions that they may experience, and that they, like you said, have that support and have the resources available if they need more help to kind of get through that postpartum period.
Yeah, Kanisha, I definitely agree with you that Black women, especially expectant Black mothers, should be well aware of the red flags that happen emotionally in terms of their emotional well-being. But equally important is knowing those red flags for certain physical conditions that generally plague Black expectant mothers. For instance, high blood pressure. Ask your doctor, is your blood pressure okay? Because if high blood pressure goes unchecked, then it can lead to a condition called preeclampsia. And preeclampsia, if that goes unchecked, can lead to worsening things such as the mother and baby, both life being endangered. Knowing those signs of preeclampsia, such as swelling of your face, your hands, you got elevated blood pressure, if you have some belly pain, those are also that maybe indications that your symptoms are worsening. So I think that we as Black women, especially if you are pregnant or thinking about becoming pregnant, learn those signs, learn to ask questions, and then also ask, how can I, decrease my risk of these things?
And going to that 6-week, postpartum check is very important as well, which a lot of people miss. And so that's really important in terms of making sure that some of those complications you just discussed are not missed afterward.
Yeah, well, I think there's, definitely that physical component, as Eunice and Kanisha discussed, as well as the emotional component, Chanel, that you discussed. Any thoughts before our wonderful guest joins us?
Well, I just think this is going to be really rich information, and I am excited for our guests to hear all the wonderful initiatives that our guests will be discussing today. And I hope that they can kind of really take something back to their communities and kind of help other women.
Especially the tips that they shared as well. I hope to be very helpful.
All right, ladies. Well, we have a very special guest to welcome today. Her name is Saleemah McNeil, and she is a reproductive psychotherapist, a certified lactation consultant, professionally trained birth doula, and a traumatic birth survivor. Working in the Department of Corrections as a Philadelphia County Jail-based case manager, it ignited anger and passion, which ultimately guided Saleemah to a master's in clinical psychology and counseling. After watching years of unfair treatment and inhumane conditions, reproductive injustice, systemic racism, and trauma, Saleemah founded a nonprofit organization, Oshun Family Center. Saleemah has dedicated her work to helping families of color heal from traumatic birth experiences and transition into parenthood. Welcome, Saleemah. We're so glad.
Thank you so much.
She has so many things checked off that African American women need. I heard breast feeding probably as well, consultation. I heard doula. I mean, those are two of the most services I think that we as Black women need in particular, and to have somebody that looks like us, so that I'm so excited that you have all of those boxes checked.
Thank you. I thought they were really important, and throughout my career, I've done one thing or another. And so when I got to this juncture in life, I said, how do I put it all together? So that's kind of how the organization was founded, just a little bit about how the organization was founded and different things that contributed to that coming to fruition.
Yeah, so tell us about how you started your nonprofit organization.
So Oshun Family Center was started in 2018. I had been thinking about a way for me to put together all of the professional and personal experiences that I've had related to parenting and childbirth, and what I can do to help circumvent some of those issues from happening again. So I founded the organization initially to a specific population, which is Black folks who are entering into the world of parenting, trying to get pregnant, coping with after pregnancy, and really helping to address perinatal mood and anxiety disorders as a visceral response to the merciless slayings that occurred last year with George Floyd, Breonna Taylor, and Ahmaud Arbery. I knew that I could pivot in a way to also support the community to adjust to racial trauma. So those things now coupled together with birth trauma and racial trauma and those intersections are the reason why I started the organization. In addition to my birth experience with my now 15-year-old, when I teach parenting classes, I'm like, I got 15 years into this parenting game. So I'm not an expert, but we've done some things great and then some other things we had to change. So my birthing experience with bringing him Earthside really served as a catalyst to me being in this community, because there were things that were done, there were things that were said, there were procedures that were pushed on me that I didn't fully understand why they were happening, for one, which throws informed consent out of the window. And it was necessary to continue in that way. So I knew that I didn't want other Black families to experience those things, and that we can all work together to dismantle a racist system.
You know, as a pediatrician, and I sit and I think about some of the families that I see and just kind of hear some of their experiences, it does make you ponder and think a whole lot about, like, how did they get here? You know what I'm saying? How did this happen? And, you know, what are some of the issues that you addressed or that you see that is most troubling for African-American families, either with parenting or just as a woman who is pregnant, trying to get pregnant? What are some of those biggest issues that you often see and that you address?
I feel like this is the tale of two stories. You have one side, which is parents, families, direct service organizations, providers that are all person client facing. And then there's the institution, the education system, the medical system. And I feel like I'm somewhere in the middle trying to pull them together because there's a big gap. So what I see is the disrespect that Black women and women of color face as birthing people here in Philadelphia, and from the medical community, how they aren't listened to and how that goes into the trust and mistrust with the medical system that ultimately impacts their birthing experience, and then impacts their fourth trimester, that leads to some of those fourth trimester fatalities within the Black maternal mortality rate. Unfortunately, the Black maternal mortality rate here in Philadelphia, 73% of the women who passed are Black. And when we really dive into the reasons, we can say, like, absolutely, are there medical reasons that really impacted this family? Were there cardiomyopathy and hypertension, preeclampsia, hemorrhaging, and all of those things? Absolutely, right? But what are the stressors behind that help exacerbate some of those conditions? Because we know stress is a major factor in cardiovascular issues. So when we look at as a holistic approach, what is really impacting that birthing family is the disconnect between person facing direct service, bottom up, and the institutions from top down. So if you don't retrain this racist system, if you don't dismantle it and do something different, down to the textbooks that the providers are taught from, that have literally stated in print that Black women feel pain at a different rate, then we're doing a disservice to our community as a whole. And that's what we're facing.
Saleemah, that is such a good point. You mentioned something that I'd like for you to tell our audience a little bit more about. I am always fascinated about this term called the fourth trimester. Can you talk about why it's such an important concept, not only for the infant, but also for the mother?
The fourth trimester is that time after a pregnancy, no matter how the pregnancy ended. You are now in a postpartum phase, and postpartum isn't just 6 weeks. We've also been trying to advocate for, I think it's ACOG and the other organization for pediatricians, to also understand that 6 weeks out isn't enough. And so how can we start to see people maybe 2 weeks out to get a better pulse on what's going on? Because that first year after a pregnancy is when the family is most high risk, when the birthing person is most high risk to succumb to some of these circumstances. And so in that fourth trimester, we have lactation issues, we have adjustment issues and transition, we have medical problems that persist from birth that still impact in that part. So that year after the pregnancy is over is the fourth trimester. And it really takes the birthing person almost a year to start feeling like themselves again. And we don't fully understand or fully explain like how childbirth impacts your pelvic floor, how childbirth impacts your abdomen. And those things are really important to you feeling like yourself again. Going to a pelvic floor therapist, going to a physical therapist, meeting with a therapist, a psychotherapist, to really help throughout that time. And most importantly is building community, because when there's isolation, there is tragedy. And so we want to make sure that we are continuing to build a village as we know it takes a village in that fourth trimester.
I think all of those things are very important. I mean, even as a health professional, as a pediatrician, I remember having my son and just remember feeling like, oh, my body is making these changes that, is this supposed to feel like this? I have had some training in some of that, right? But not just really knowing what the actual process would feel like. You talked about having, even a therapist, having a baby is a phenomenon that just changes your life so quickly. And, if you think about it, if everybody had like a therapist or a parent coach to kind of coach them through that process, I think we will all come out so much better. So I think all of those things are so very important, especially during this time of COVID where we have so much isolation. So can you talk a little bit more about how, because we know that we talked earlier about the effects of maternal mortality, in particular for Black women. Can you talk to a little bit more about how during the COVID times that your organization has tried to address some of those effects during COVID?
Absolutely. Actually, prior to COVID, we were like laying the groundwork to launch a pilot program that was going to be in person. It's called the Village Connect. And we have a triadic approach to maternal care, especially throughout that fourth trimester. So when COVID hit, we had to pivot for it to be an online support and group for those birthing families. And so with this approach, we provide 12 free therapy sessions. We provide lactation support and childbirth education to help through. When COVID hit, we had to transition to now address the isolation that the families were facing, the separation of a birthing person going into the hospital alone to give birth and not have a partner, not have a support person there. We have to deal with after birth in the midst of a pandemic and not having the support that you need during that time, because family can't come over, and where the community would usually be all in to help and support that family, they no longer have that. So there've been instances of that isolation also leading to depressive symptoms and anxiety. I don't want to get sick. I don't want to die. I actually had COVID last year around this time, and watching the highlight reel of everything that was happening, seeing refrigerators outside in Center City, not just in New York, but in Center City in Philadelphia, because there was an overflow of bodies that could no longer fit in the morgue, was just devastating. And I could not imagine being a birthing person during this pandemic, seeing that on TV and still going into a hospital to deliver my baby, which as a response to that, our home birthing community here in Philadelphia really band together to expand access to home birthing for families who were afraid to go into the hospital and who otherwise didn't think that home birth was an option for them. And so with the program, we were able to launch our pilot, have a small cohort of families who needed support during that time and able to access all of these services virtually. And so isolation, anxiety, depression, just being scared, you're a parent, so many things happening all at once and causing tragedy.
Yeah, such a tough time for so many people. I wanted to kind of ask you a little bit more about breastfeeding. And, if you could talk to our audience about those people who might be fearful of breastfeeding, what do you do and what do you say to help them?
So I work with teenage parents in one facet, and then I work with adult parents in the other facet. And there's been a wave, I would say, over the last decade, especially with hospitals banning the bag. That means that the bag that they used to give as a gift had formula in it. And so they no longer gave that. And so I think people are more inquisitive about breastfeeding and not necessarily fearful. When I run across people who are fearful of breastfeeding, as a therapist, I already understand that there's body trauma. So let's talk and let's process through that body trauma. And also providing an alternative. Pumping is still breastfeeding. You're still providing your child with breast milk. I think pumping seems to be like secondary. Like if you can't breastfeed, then you can't do anything. But there is a secondary option. You can exclusively pump and your child can get everything that they need from the breast milk. So I try to do education around that when it comes up in session or when it comes up with my families. I also have a team of amazing certified lactation consultants and IBCLCs, which is internationally board certified lactation consultants, who do a deep dive into those families who really need more support than what I can provide them and give them techniques and different strategies to overcome their issues that they may have. And so as a therapist, if I see fear, if we're discussing that, we talk about body issues that may have come up, because people who are survivors of childhood sexual abuse or of sexual abuse are less likely to want to breastfeed because of what it means to their body. But being able to work through that and help them process is really a monumental journey that once they overcome, they can actually find joy in that journey and also see their body in a different light. And so I let people know fed is best, because there's some lactivists out there who are just like, no, breast milk is the only thing. And I was like, I get it. And I used to be one of those people. But as a therapist, I know the devastation that a family can face when they can't breastfeed.
Could you talk to us a little bit more about that? Because I think that flip side is really fascinating too, as a psychologist and and a mother myself, women go through trauma because they believe that they're not good enough if they can't breastfeed for whatever reason. So can you tell us about that?
Absolutely. And it also stems from different aspects of birth and how providers talk about the body of birthing people. If during your pregnancy, your cervix starts to dilate prematurely, then you have an incompetent cervix. And just using those words to describe a body for a person is devastating. And it goes into, all right, now in the postpartum phase, I want to be able to provide this golden opportunity, this golden milk, this nutrients, these antibodies, everything that I can, but everybody doesn't have that opportunity. And I don't think we talk about the flip side enough, because we'll push breastfeeding. Yes, how do you plan to breastfeed? How do you plan to feed your baby? There was one point in time where I worked for an agency where the question was, how long do you plan to breastfeed? And I was like, well, that's presumptuous. Like, can we ask them how they intend to feed their baby? Because breastfeeding may not be an option. And so when that devastation that really sets in for parents, it's a grief and loss process of how they intended to parent, what they thought the journey was going to look like, and how we can pivot together to better understand what the options are. What's going on with your body? Are there things that we can do to help milk production? Or can you do donor milk? We don't talk about donor milk enough. One, because I think that there's systemic racism within donor milk as well, because parents who donate their milk to milk banks, often other parents have to buy it from that same bank. And the fees are just out of this world, unless you have a NICU baby, and you can use donor milk as long as they're in the hospital. But when they leave, you don't really have an option. And then using donor milk from a friend or a close family member who's also breastfeeding, that's frowned upon from the medical community. But it's absolutely fine, because Black women were wet nurses for how many babies on slave plantations? Like, these are ancestral practices that were already being done that are now being policed by the medical community. And so really working with parents to understand what their options are, whether it's exclusively pumping, providing their breast milk, using donor milk or formula, and just working with them to understand that it's okay. Because the goal is for your baby to be fed. The goal is for your baby to thrive. The goal is for your baby to gain weight. And if that is by way of a mixture of formula or strictly formula, then it's all right, because we want the parents to be okay mentally and work through that grief and loss process and not just lose all hope because this part of the journey doesn't work.
As a pediatrician, it is so true about, the best option is fed. Like, I have a lot of conversations with families that come in and, they feel so bad because, I didn't get this much amount of milk. Because in some groups, some people will post how much milk they get, and, they're trying to do all this stuff to do the same things. And really, the child is growing fine. So it's really nice to hear that other people are also agreeing that the best option is really just to feed your baby. Do the best that you can do. Quit having all of these expectations of what a great mother and a good mother looks like when you are that great mother and good mother, because you're doing the best that you can do and your child is still growing. Those are also exciting things. So with April the 11th through the 17th, we have Black Maternal Week coming up. Can you talk to us and our audience about some events to look forward to, or what you may be planning, or what other events you may know about as well?
Black Maternal Health Week is national. It was started by Black Mamas Matter Alliance, I want to say in 2017 or 2018. It is to uplift and raise awareness on about Black families, especially the Black maternal mortality rate and the atrocities that we face within the medical system, to amplify the voices of Black people and highlight our experiences. And so April 11th through the 17th, our Philly-based Black Maternal Health Week, we are doing events Monday through Thursday. We have the Power of Knowledge, where we will talk about different legislative pieces that have been introduced that impact Black bodies. We're also talking about how city planning impacts maternal health, how we have Dr. Irene Heaton from Drexel University, who will be speaking about the public health part of of Black maternal mortality, and the State Representative Morgan Cephas from the 191st District that will be discussing more in-depthly some of the bills that she put in place to support the advancement of Black bodies. So we have a really good lineup for Monday. Tuesday, we're talking about body sovereignty and liberation and being able to have agency over your body. And we are highlighting some of the stories of a pandemic mama who has now been isolated through the pandemic, figuring out COVID and vaccinations and all of that. And we have a really good lineup for that one as well. On Wednesday, we're talking about infertility and how it impacts in the Black community. Also, how you deal with grief and loss. And then we're rounding out our portion of the week on Thursday with a screening for Belly of the Beast, which is an expose documentary that talks about forced sterilization within the prison system, specifically in California. And so Philly-based, that's what we have. Also, Black Mamas Matter Alliance, they have a boatload of activities going on for that week, different ways to engage on Twitter. And also their conference is the 15th and the 16th, or the 16th and the 17th, so Friday and Saturday of next week. What I want everybody to know is this is a cultural experience. Yes, we are giving information, we are raising awareness, we are charging people for change, to be agents of change after this. But this is a Black cultural experience that will highlight the nuances of our lives and our living and our being as Black birth families here in America.
That sounds absolutely incredible. We encourage everyone to check out the Oshun Family Center website. Anything else that you wanted to share with our audience today for a closing statement?
I hope to see everyone there. We have some really great things planned. We also, to bring this as a cultural experience, we have Black performers that were open and closed all of our days. We also have really great swag bags that if you give a $25 donation, we will send you a swag bag that has a t-shirt and a hand sanitizer and different buttons and stickers and things. And so to help us continue to do this work year by year, planning for Black Maternal Health Week, it will be great for you to come because numbers matter, and also give us a little donation so we can send out all of these great swag bags. And I truly hope that if not one of our events here in Philadelphia, that a event throughout the nation that you are able to attend to get more information on Black maternal health.
Thank you so much, Saleemah. That was such a wonderful discussion. We were so fortunate to hear about all of the initiatives that your nonprofit is doing for Philadelphians and for people all over the country. So we're very thankful for what you've shared today. Thank you so much for listening to us today on our podcast. Please stay tuned for our next podcast, which will be part 2 of Dear Mama, Black Maternal Health Matters. Please don't forget to follow us on Facebook at Melanin Hues Podcast. Also follow us on Instagram at Melanin Hues Podcast and Twitter at Melanin Hues Podcast. Lastly, don't forget to check us out on our website at melaninhuespodcast.com.